Your liver could be getting damaged right now, and your blood tests could look completely normal. I know that sounds alarming, but that's exactly how this disease works. Your liver itself doesn't feel pain, which is why you often don't notice anything in the early stages. No warning system, nothing tells you something is wrong until it's been wrong for years. Patients walk in a hospital feeling fine, and their ultrasound tells a completely different story. It's called fatty liver disease, and worldwide right now, 1 in every 3 adults has it. In this video, I'm going to show you exactly what it is, how to know if you have it, what's causing it, and what actually reverses it. Before we go further, your liver does 3 things that matter here. It filters every drop of your blood, it controls your metabolism, and it processes everything you eat, drink, and swallow. It's not just an organ, it's your body's control center. And it does all of this completely silently, which is exactly why, when it starts failing, you don't notice, until one day, you do. Fatty liver is not one disease, it's a progression, and where you are on that progression changes everything. Stage 1. Fat in the liver. Your liver cells are accumulating fat, no symptoms. Your blood tests can sometimes look completely normal. This stage is completely reversible. Stage 2. Inflammation starts. Your body is now reacting to the fat with inflammation. You might feel persistently tired, still reversible, but the clock is ticking. Stage 3. Scarring begins. Fibrosis. The liver's texture is changing. Partial improvement is possible, but full reversal becomes difficult. Stage 4. Cirrhosis. Widespread, permanent scarring. Liver failure risk, liver cancer risk. This damage cannot be undone, and most people only find out when they're somewhere between stage 2 and stage 3. A patient who came in for something completely unrelated. Routine checkup, no symptoms at all. Was picked up fatty liver accidentally on a scan. He was genuinely shocked because he thought he was doing everything right. That's the cruelty of this disease. It doesn't warn you. The good news, if you're watching this, you almost certainly still have time. Most people are caught at stage 1 or 2, where this can be fully reversed. Now, here's a myth I want to bust right away. Fatty liver only affects overweight people. This is one of the most dangerous misconceptions about this disease, and some of the most shocking cases are people who look completely fit, normal weight, slim even, and their scan shows significant liver fat. There's a clinical term for this, lean NAFLD, and it's disproportionately common in Indians and South Asians. Our genetics make us store more visceral fat. That's the fat that wraps around our internal organs at a lower body weight than Western populations. You can have a perfectly normal BMI and still have dangerous levels of fat around your liver. Add to this that India has one of the highest rates of insulin resistance and pre-diabetes in the world, and you start to understand why this disease is epidemic here. Most people don't have a liver problem. They have a lifestyle problem that their liver is paying for. If you've never had your liver enzymes checked, a liver function test is a simple, cheap blood test. Add it to your next health checkup. It could be the most important thing you do this year. So, what's actually filling your liver with fat? Now, this is where things get a little interesting and where most people are genuinely getting it wrong. Eating fat does not cause fatty liver. The real driver is how your body handles sugar and carbohydrates. When you eat foods containing fructose, it travels directly through the portal vein, straight into your liver. Unlike glucose, which gets distributed across all your body's cells, fructose is almost entirely processed by the liver alone. And if your insulin is already elevated, your liver converts that fructose directly into triglycerides, fat, stored inside your liver cells. And fructose has a much weaker effect on the hormones that signal fullness, so you can drink a liter of packaged juice and feel hungry 20 minutes later. That's not a willpower problem, that's biology. So if I simplify all of this for you, Your liver is basically being forced to turn sugar into fat. And this effect becomes much stronger when there's excess calorie intake overall. That's the whole mechanism in one sentence. The bottom line. This is largely a diet and lifestyle-driven disease, which means you have more control over it than almost any other chronic condition. Here's the thing about fatty liver. In early stages, there are basically no symptoms. The most common way it gets found is during a routine blood test, when your ALT or AST levels, your liver enzymes, come back slightly elevated. Some people notice persistent, unexplained fatigue, tiredness that sleep doesn't fix. That was your liver trying to get your attention. Others feel a dull, heavy ache under the right rib cage, but many people feel absolutely nothing. As the disease progresses, the signs become serious. Yellowing of the skin or the whites of the eyes. That's jaundice. It means bilirubin is building up because the liver can't process it properly. Dark brown urine, pale or greasy stools. You bruise more easily than before. Your legs or feet start to swell. Your abdomen becomes distended. And if you ever see tar-black stools or you vomit blood, please go to a hospital immediately. This can mean blood vessels around your liver have ruptured, and this is a life-threatening emergency. In the next section, I'll tell you the one thing most doctors don't actually discuss with patients. And it's the difference between people who reverse this and people who don't. Here's what actually works. Studies show that just a 5% reduction in total body weight measurably reduces liver fat, and 7% weight loss can produce near-complete resolution of stage 2. You don't need to become a different person. You need to make a few specific changes consistently. 1. All sugary drinks. Cold drinks, packaged juices, energy drinks. A glass of packaged orange juice can contain the sugar equivalent of multiple whole oranges, but without a single gram of fiber to slow it down. 2. Added sugar in all forms. If you're having 4 cups of chai with 2 teaspoons of sugar each, that's 30 to 40 grams of sugar from tea alone before you've eaten a single meal. 3. Ultra-processed foods. Packaged biscuits, chips, instant noodles, sugary cereals. They're a combination of refined carbs, inflammatory oils, and preservatives. 4. Refined grains. Not all grains. Whole grains are fine, but Maida products and large portions of white rice spike your blood sugar rapidly and drive insulin resistance. 5. Highly refined vegetable oils. Packaged sunflower, soybean, and corn oil in excess are associated with metabolic inflammation. Switch to mustard oil, ghee, cold-pressed coconut oil, or olive oil for cooking. Now, what to actively eat. Start your day with a high-protein breakfast, 25 to 30 grams, eggs, paneer, curd, sprouts. Research shows this directly suppresses sugar cravings for the rest of the day. Add walnuts, flax seeds, or fatty fish twice a week. These are your omega-3 sources. A meta-analysis from 2018 showed direct reductions in liver fat with omega-3 supplementation. Berries, broccoli, and beetroot all contain antioxidants specifically shown to reduce liver inflammation. And replace your morning tea with 2 sugars with black coffee or unsweetened green tea. Regular black coffee has been associated with liver protective effects in multiple studies. Exercise matters independently of diet, not instead of it. Minimum 150 minutes of moderate activity per week. Brisk walking counts, plus resistance training twice a week. These are not optional. They are active, proven treatments. Stop constant snacking. Every time you eat, insulin spikes. If insulin is elevated all day from continuous grazing, your liver is continuously converting sugar to stored fat. Eat 2 or 3 proper meals and let your insulin levels come back down between them. This alone can make a significant difference. Now, the thing I promised I'd tell you. There is no simple pill that fixes fatty liver, especially in early to mid stages. A first drug was approved in 2024 specifically for the most advanced inflammatory stage, but it's a prescription treatment for a specific severe subset of patients. For the vast majority of people watching this, lifestyle is still the only real treatment that exists. 3 supplements do have meaningful clinical evidence behind them. Omega-3 DHA from fish oil or algae. A 2018 meta-analysis showed direct reductions in liver fat. Vitamin E has shown to help stage 2, but the evidence has nuance. And choline from food. Egg yolks, paneer, broccoli, sunflower seeds. Choline deficiency is directly linked to higher liver fat. And on the topic of supplements, if you've seen a liver detox tea or liver cleanse product being sold online, I'll save you the money. There is no clinical evidence that any of them work. None. Your liver doesn't need a cleanse. The scary part about fatty liver is that it doesn't hurt until it's too late to undo the damage. But the hopeful part is this: you can reverse it. Starting today. Your liver has been working for you every single day without a single complaint, filtering everything, processing everything, keeping you alive. Silently. Now it's your turn to decide what you're going to do with that information. This is Medvora, where we bring you the medical information that actually matters, explained the way it should have been explained to you all along. Subscribe for more.